A COVID-19 outbreak could last for a long time in your community. Depending on the severity of the outbreak, public health officials may recommend community actions designed to help keep people healthy, reduce exposures to COVID-19, and slow the spread of the disease. Local public health officials may make recommendations appropriate to your local situation, but in order to assess whether we are moving in the right direction or not, we created this predictive model to help us to track the situation in Egypt and to make the proper forecast concerning the rate of new cases and mortality rates as well. But before going further into the model, we need to go back in time to navigate the situation from the start. On December 31st, 2019, a cluster of cases of pneumonia of unknown origin in people associated with the Wannan seafood wholesale market has been reported in Wuhan province in China. Only a few days later, Chinese health authorities confirmed that this cluster was associated with a novel coronavirus and was named later COVID-19 by WHO. Confirmed by comparative homology analysis, COVID-19 is closely associated with bat-derived severe acute respiratory syndrome, SARS-like coronavirus with 88% identity, but is far away from SARS coronavirus about 79% and MERS coronavirus about 50%. On Friday, February 14th, the Egyptian Ministry of Health announced officially the first coronavirus infection for a Chinese national in Egypt. On March 11th, the WHO has made an announcement based on further assessment that COVID-19 can be characterized as a pandemic. The Egyptian government has made strict decisions to control the situation. All meetings, conferences, and large gatherings have been suspended. Schools and universities have also been suspended. The country has devoted a 100 billion Egyptian pound budget to fight the spread of the disease. And lastly, a military curfew has taken place to minimize social gatherings and to limit the disease spread through the appropriate social distancing as recommended by the WHO. Now, these are the official numbers from Egypt reported by the Egyptian Ministry of Health, dated March 25th, 2020, represented by the daily cases, the daily deaths, and the daily recoveries. And we can see here that we have reached a total of 456 number of infected cases, 21 deaths, and 95 recoveries, with 113 patients have turned from positive to negative PCR. So there is a desperate need for a predictive model to assess the current directions and to guide our future decisions. To help you figure out our predictive model, we need to go back to some of the statistical basics that will perfectly make you aware of what we're going to be talking about. Simply, if you plot your data on a graphical chart where on y-axis is the variable of interest you want to predict, and on x-axis is the time points at which you observed your data, upon plotting, you just made a plot called scattered plot. Each point has two coordinates, x and y, where x represents the time point at which the observation y is being collected. So this is an actual scattered plot for total confirmed infections in Egypt with COVID-19 upon 36 time points from 15th of February until 21st of March. Now try to connect the points together. Why should you do so? Upon connecting the points, you can assess how the observation's value increase by time. If there is a strong correlation, you can make a mathematical function to estimate the next time points. Statistically, and to be more accurate, how the change in time explains the change in y-axis variable. Okay, this is the best fit line. Mathematically, the change in time, x-axis, can explain only 69.2% of the change in total confirmed infections on y-axis. The line cannot connect all points. The distance between the line and the point is called residuals or errors. So many mathematical functions can be tested to pick up one which would perfectly assess the correlation between x and y variables. In other words, perfectly connects the points together but in a mathematical rhythm. Now let's present a new equation called the cubic equation. The cubic line almost fits all points perfectly. This equation tells us that the change in time explains 99.2% of the change in the total confirmed infections. You can utilize a function that is statistically significant. The correlation is not by chance, it really exists, and having a good R square, which is the percentage of explanation of y depending on x. So you can endlessly put x and predict y. Now let's interpret the best function and see what it tells us. So if we have analyzed the data from Egypt, and upon applying different mathematical equations, we can see here that the cubic function perfectly describes the data with the highest relevance explaining its relationship with time up to 99.7%. So if we have actually plotted the data from Egypt according to the actual confirmed number of infections over 40 time points, 40 days, starting from Feb 15th until March 25th, we can see here that the cubic function perfectly describes the data, while exponential function is somehow relevant but is still far away. However, this doesn't exclude the possibility that the curve might turn into exponential one over a certain time point. So now we're going to make our prediction until day 56, dated April 10th. We're going to talk about two different scenarios. The first one, that the curve will maintain behaving according to the cubic function. The second scenario, which is the worst case scenario, that the curve at a certain time point will turn into an exponential one. So talking about the cubic function or the cubic curve, if the daily new cases continue to increase within the same rates, our prediction that we will almost reach 1,620 patients on April 10th. But in the second worst case scenario, if the curve have turned into an exponential one over a certain time point, our estimation predict that we will almost reach to 14,000 cases on April 10th. Our ultimate aim is to reach plateau, meaning that there is no increase in the number of new cases. As we already mentioned that the cubic function perfectly describes the change in total number of confirmed infected people by time. All countries are seeking to change the curve to a logistic one. What is the logistic curve? It is a similar curve to the cubic one, but at a certain time point, the curve inflects to a plateau, meaning that it is being constant with time. So all countries will set a hypothetical upper bound of a logistic curve. In this case, we set a hypothetical upper bound of 1,000 cases, which is the point at which there is no further increase, and afterwards there is a plateau in the number of total infected people per day. So why did we set this hypothetical upper bound? This is actually our target that we need to track and keep an eye of. So we can see on daily basis whether if we are approaching this target according to a special behavior, so the government needs to apply more stricter preventive measures to the population, or the population needs to be more strict to the social distancing in order to reach the plateau over the desired point of time. Moving to a new country, this is the data from Italy. And upon applying different mathematical equations, just as we did with the data from Egypt, we can see here that also the cubic function perfectly describes the data with the highest relevance explaining its relationship with time up to 99.6%. So if we plot the actual reported data According to the confirmed number of infections in Italy, over 55 time points, 55 days, starting from Jan 31st until March 25th, we can see here that this is the cubic curve that we will actually see. This cubic curve perfectly describes the data and represents it. But there is actually a scenario that at a certain time point, this curve might switch into an exponential curve, which is the worst case scenario that we need to avoid as well. So if we're going to make our prediction for the data from Italy until day 71, dated April 10th, we will do exactly the same as we did with Egypt. We will assume that there are two different scenarios. The first one is the data will continue to grow within the same rate and the curve will maintain as a cubic one. The second scenario is at a certain point of time, the curve will be switched to an exponential one, which is the worst case scenario. So in case of the cubic function, if the daily new cases continues within the same rate, our estimation predicts that Italy will reach almost 235,000 patients on April 10th. But the second worst case scenario, if the curve switched to an exponential one, our estimation predicts that on April 10th, the number of cases will reach to 1,100,000 patients. Our ultimate aim is to reach plateau, meaning that there is no increase in new cases over time. As we explained earlier, that the cubic function perfectly describes the change in total number of confirmed infected people by time for Italy data. So upon setting a hypothetical upper bound, aiming and hoping for the curve to turn into a logistic one, and for the purpose of flattening the curve and having no increases in the new cases, we set a hypothetical upper bound of 100,000 cases. So we need to keep a close monitoring of this target and to be updated on daily basis about the reports that is being officially announced, so it can guide us whether if we're moving in the right direction or we need to apply an extra preventive measures directed from the government and from the population. And now let's talk about the data from the US. When we apply different mathematical equations, the same as we did with Egypt and Italy data, here we can see that the exponential function describes the data from US to some extent, with relevance explaining its relationship with time up to 88.5%. However, since that is not perfectly describe the relationship between the outcome and time, we have to wait for additional time points so the data can be mathematically explained in a better way and to be more relevant. So we made a retrospective data collection to the actual confirmed infections in the US in order to make a hypothetical prediction over the past 14 time points, 14 days, starting from March 12th until March 25th. By focusing on a segment of the curve, mostly explains the latest increase rate in the US. Let's take, for example, the data 2 weeks ago, equivalent to 14 data points, and then observe the average increase rate. You can calculate that rate of increase by simply dividing each observation by the previous one, and then take that average increase rate, which is equals to 1.35, and then apply it till time point 76, dated April 10th, and then see the curve. So after applying this rate of increase to that curve and assuming that it is an exponential one, we can see here that the daily new cases, if continues to increase within the same rate, our prediction that US will almost reach 800,000 patients by April 10th. And here, as you can see from the curve, even the exponential one fails to predict the data completely. That's why we need an additional time points to verify this prediction. So our take-home message is that time matters. The model is not constant. If you build a model, then every intervention that would change the correlation between time and y variable will make your model less accurate over time. You must update your model with the new updates, plot more and more observations. Good interventions would change an exponential or cubic functions to a logistic one. The logistic was an exponential one, but at certain point, the vertical line on x-axis changed his angle with time to be horizontal. In other words, there is no increase in y by time x. So every decrease in daily reported numbers according to a certain behavior, whether social or governmental, will change the predictions accordingly. Behavioral changes along with the governmental strict actions will help reach the targeted upper bound and hence flatten the curve. Thank you very much for your time. Keep yourself and your family safe.